If you're ever wondering, do I fit at AstraZeneca and the graduate programs? This episode is for you. Real career talks on how to get in at AstraZeneca, thriving in life as a graduate. My name is Amanda Gärdeman, and I work with employer branding, but today I'm your host. And with me, I have my brilliant panel. So I think we should start with some introductions, guys. Let's start with you.
My name is Petra Werenmark, and I work as a talent acquisition business partner with a focus on early talent recruitment.
I am Bernardo Herrera. I am a global operations graduate program from Mexico that I relocated to Sweden recently. Basically, what the global operations section does is delivering our medicines to our patients from PT&D all the way to the customer in all the supply chain. I studied biotech engineering and I work in sustainability here in Sweden operations.
Yes, and my name is Sofia Hjalmarsson. I'm a PT&D graduate and I have a background, same as you, in biotechnology engineering and masters. I'm a PT&D graduate, so PT&D stands for Pharmaceutical Technical and Development, which is basically the link between R&D and into operations. So we do everything from, product development, from inhalation to oral to drug delivery, devices, you name it. And so primarily I'm here in Södertälje as well and doing my second rotation.
And I'm Giulia. I come from Italy, from a small village in the northwest of Italy. I study pharmaceutical chemistry and technology, and I then relocated to Sweden to join the R&D graduate program. R&D stands for Research and Development, and I'm part of the chemistry scheme. So what I usually do is chemistry. So you can join the chemistry program by doing medicinal chemistry. You can join by doing innovative therapies, for example, products, but also oligochemistry. So the possibilities are multiple, and I'm really happy to be part of the program.
I'm Viktor Spreng from Germany. I relocated to Sweden to join the Data Science and R&D grad program. So similar to what Julia told you about, it's research and development, but it's data science and AI. So that means I'm working from data analytics towards more advanced AI concepts. But my original background is actually physics, so was not a very strict career path until here. Happy to be here.
Yeah. Nice, guys. Different programs and different backgrounds. Love to hear that. I think, Petra, we should start with the basic. So what is the AstraZeneca graduate programs?
It is a 2-year rotation program. It's designed for recent graduates who wants to kickstart their career. By joining the program, you will have the opportunity to really develop your personal and professional skills. You get the opportunity to rotate between different roles and also different functions. The program is available in 11 different countries. And here in Sweden, we hire across R&D, operations, and the cross-function pharmaceutical technology and development. So the bottom line is 2 years, 3 rotations, lots of learnings, and to really discover what's your best at.
As you mentioned, we have different global graduate programs in different business areas. I mean, is there a difference, and who can apply for these programs?
The qualifications varies by stream. We are looking for graduates who are motivated, curious, and eager to learn. You should have skills like problem solving, like communication skill, motivation, it's really important that you have those to be successful in this.
Soft skills, basically, right?
Yeah.
Soft skills all over, yeah.
And I mean, it's really broad as well. I mean, you can study a lot of different things as well. It's not just pharma or biomedicine to enter AstraZeneca world. You can study a lot of different, come from different backgrounds, as you guys. On that topic, you have had different journeys before coming in as AstraZeneca graduates. So I'm really curious why you applied for this program. So if we start with you, Sofia, why did you apply for the PT&D graduate program?
Yeah, so Like in general, I have a background with AZ. So I started as a campus ambassador like back in 2020 or something. And then I've been like a summer intern in the R&D department. And then I also did like my master thesis. And then I went off to living in Australia and I got my master's degree and everything. And then I just thought that like the most like natural step would be to do like a trainee program or like a graduate program, because I felt like that was what the majority of like my mates did back then. So then I applied for it, and I applied for a lot of like different programs, but in general that's like the reason why I applied. I wanted really to come back to AZ again, and to somewhat like all of my previous experience within AZ has been like primarily in R&D, but now I wanted to explore like the phases further down in the pharmaceutical chain. So then I thought that if a PT&D program would suit me good, because then you were gonna be in the bridge between R&D and operations and explore that phase.
Yeah, amazing. I love that. Welcome back to AstraZeneca. And the three of you have actually relocated here from different countries. So with you, I'm also excited why you applied, but I'm really excited to why Sweden.
So maybe I can start. So actually, I didn't know I was gonna apply for the graduate program. So in my background, I studied multiple studies. So I really got the chance to study pharmaceutical technology. I also got the license to be a pharmacy. So I always got excited to be part of a pharmaceutical company. And I didn't know exactly which one I wanted to be part of. But one day I was scrolling on LinkedIn and I found the graduate program. And I thought, oh, this is the job I was looking for. I really want to do this. And I got the chance to explore and apply the knowledge that I learned during my university studies. And I mean, the graduate program was the perfect fit. It was chemistry. I'm a medicinal chemist, but it's also pharmaceutical background. So it was the best combination. And to be honest, I didn't check in which country it was. I knew that it was going to be somewhere. It was Sweden, US, UK. I didn't want to move very far away from where I was. And back then I was in Germany already, so I was not in Italy. And I thought, I mean, Sweden is not so far away. I can just move a bit farther north. It's gonna be a bit darker. Maybe it could be challenging. But I mean, in the end, I felt it's gonna be another country where I can live and challenge myself. So I said, okay, I'm gonna try. When I applied, I thought maybe this is too ambitious, but in the end, here I am. So
There you are.
But no reason that you're moving up north all the time. Is it going to be Alaska?
so no Germany, Sweden. I don't know what is coming in.
You guys.
Actually, a similar story. I didn't really plan to come to Sweden, but what I wanted to do was a vacation in Sweden at some point.
Yeah.
So I was thinking maybe moving there is on the same level as having a vacation there. I just knew that I was interested in Sweden, nature here, and it's amazing. So you can go outdoors and you can have a great time. So I had a positive view on Sweden. Never really planned to move here. I moved here because the program was here and it fit my goals, objectives very well, like these great programs in general. So it was a good fit. Similar to Julia, I was like, that's the thing. I need to do it. I need to apply.
Yes, and in my case, I did choose Sweden, but it's a bit of a different.
One of us is
So I started the program in Mexico. I did my first 2 rotations in Mexico City. And in the program that I am, we had the opportunity to choose an international assignment. So when choosing, we had the opportunity for all the sites that AstraZeneca has over the globe. So I could choose Japan, Australia, US, UK, Sweden, etc. For me, the reason why I chose Sweden was because, first of all, it's the largest operation site AstraZeneca in the world. And second of all, I am very interested and passionate about sustainability. And I saw an article that AstraZeneca Sweden had reduced 98% of scope 1 and 2 emissions. And I said, there, I want to go. And I chose a rotation that fit what I wanted on my passion. And the manager chose me, I chose him, and the rest is history. So yeah.
Love your stories, everyone. But if we pause a bit on relocation, I mean, it could be difficult to relocate and leave your home behind or other countries behind. So if we talk a bit more about like how was it to relocate to Sweden, but more like how was the support of it that you got offered?
I mean, for me, it was amazing. I wasn't not expecting any relocation support. I was really planning to do everything by myself. So as soon as I received an email from the relocation service, I was like, oh, wow, that's amazing. Like, I know exactly what I have to do. I got a list and everything was described. So I knew that I was looking for an apartment, then going to the bank, then going to the mall and requests for my ID. So I think everything was really easy.
Also amazing is, I just remembered, is part of the relocation package was also Swedish courses. And now I can speak, okay, I can barely speak some Swedish, but I can understand people talking. And
So we should do the podcast in Swedish now.
we should försöka not do that just yet. Skulle vi försöka det nu?
Perfect. I love that.
That's amazing.
But maybe, I don't know if you have anything to add. I mean, more from like an AstraZeneca perspective, what relocation packages do we offer to graduates?
Like, so the relocation support is really important for AstraZeneca, of course. We do relocate, for Sweden, we relocate very many people every year, especially for the early talent programs. It's a big part of that. So it's very important that it's working, and I'm happy to hear your stories. So now what we do offer is, of course, help, as you said, with home finding, the Swedish lessons, and bank authorities and things like that, to settle in your new country. Yeah. Mm-hmm. So it's really important. So I'm happy that we are able to have that support.
we even got tax support, I think.
Yeah.
Was it also part of the package or was it some? Yeah.
Yes, it's tax and it's also pension and questions like that. Health insurance, yeah, it's also covered. So I think that was the most challenging thing. Oh my God, I'm gonna go to the hospital. Like, I don't know how to. Yeah. But everything was really easy. And you know that you can always have support. So that's it.
Great. And you, Bernardo, you moved here from Mexico. For me, it sounds like a culture shock. Is it? Or what would you say?
The biggest shock was when I left Mexico City and I took my flight. We were 27 degrees, sunny skies, and I landed on an April morning in Stockholm at -4, with flurries. And I was just wearing a light jacket, so I said, okay, I should have prepared better. In terms of culture, I think the Swedish culture is very unique. What I felt from my manager, my teammates, they're very warm. Which goes against some stereotype that you might have over the other side of the world. But they're extremely warm and welcoming. I got accustomed to the fika culture like that. On the first day I went to 3 fikas and I was shaking by the 8th day because of all the coffee. But I think a valuable thing is, I can compare between AstraZeneca's and we all share the same values. So I think we all speak the same language in that way, which kind of made me adjust a lot faster to Sweden.
Yeah.
Sorry.
Welcome to Sweden, guys.
I could add something.
Yeah.
It's not like a culture shock, but like since I'm a PT&D graduate and the program is based in the Gothenburg side, so in the Gothenburg side, there's like the majority of the people working there, as you said, has been relocated into that side and working there. So in my first rotation, I was the only Swede in that department. So, like having lunch together with all of these people from Portugal, from Spain, from India, you name it, it's very like exciting, but it's also like, it's challenging in terms of like, social codes, etc. But it's a very good, experience of working in a multicultural environment.
Yeah.
So for sure.
Yeah.
One fun fact about the office in Gothenburg is that I think we have 70 plus different nationalities.
Yeah. Sounds like we are lying.
Yeah, that is true. No, it's true. Like, I was the only Swede in the department.
Now we talked a bit of relocation, but now I would like to go back to the programs a bit more. As Petra mentioned, you have rotations within these 2-year programs, 3 to be exact. So I'm really curious what rotations and roles you have been in. And maybe we can start with you, Sofia.
Yeah. So I did my first rotation at the Gothenburg side as a data research scientist. So it was in inhalation product development within the material science and solid state team. So shout out to you guys. Where I did the primary work was image analysis, where I combined it with machine learning and to come out with this prediction model of how different liquids would be spray dried and how the final dried power particles would become, the properties of it. You know, you learn a lot about different fields, and it's very much specific knowledge in terms of the inhalation world. My supervisors, you know, they have PhDs and everything, and they guide you very well. So my second rotation, I'm actually doing it here in Snäckviken in Södertälje. So I'm at Site Respiratory, where I do work as a production and supply planner. So it's basically that I have a complete ownership for production lines, what type of orders we are going to produce, where to ship them into our customer's location. It's a lot about the bubble of my second rotation would be within global supply chain and local production planning. So it's completely different to my first rotation, which I also wanted. I wanted to somewhat explore the different fields of AstraZeneca, and now I got the option to do this, which I'm very grateful for.
Interesting. And I mean, you are both at Södertälje, so what roles have you, started in Mexico, but now here, so what roles and rotations have you done?
Of course, I'm in my third rotation now. I started my first rotation in Mexico City as a lean digital associate. So my day-to-day work was lean with digitalization. So how can we simplify everything and every process that we have towards faster, quicker, less waste, but with a digital part. So I did a lot of Power BI dashboards. I did a lot of data analytics. We're a packaging site in Mexico City, so it worked a lot on efficiency and all of that. Then my second rotation was as well in Mexico City, but it was a supply chain analyst as well. So I was, same as Sophia, I was production planner for a few months. Then I was a warehouse project manager. I did not know anything about warehouses, and they assigned a warehouse expansion project on me. And I said, well, yes, just, pile it all in. That's kind of how it works, right? So I learned a lot about warehouses in my second rotation. And now in my third rotation, I relocated to Snäckviken as well. I'm very proud, and I really like my work today because I am the site sustainability lead. So I represent Site API as a sustainability champion against the region. In how can we manage our API, active pharmaceutical ingredient, manufacturing process? How can we make that more sustainable? And ultimately, how can we become the forefront in sustainable API for the rest of the AstraZeneca network? So yeah, that's a bit
If you say sustainable API, what does the API mean?
API, so it's basically what we receive from PT&D. So it's the active pharmaceutical ingredient. Yeah.
That's what a data scientist might ask.
Yeah, that's a yes. Sorry for the acronyms. Yes.
And as you mentioned, you're on your third rotation, but I heard that you secured a permanent role here in Södertälje, so congratulations. So you chose Sweden.
I did.
Yes. And Sweden chose you.
Exactly. So yes, I'll be honest, I had my two roles, one in Mexico, one in Sweden. I ended up following with what I love, which is sustainability. And the role that was offered to me here in Sweden was to continue the work that I've been doing as sustainability lead. So I'm very happy to put my grain of salt in the world. So that's what it's.
Good hire, Ace. And the Gothenburg team, I mean, you are both based in Gothenburg. What roles and rotations have you been part of or done?
So both R&D. So we're looking at the R&D organization, which is huge. So Gothenburg is a huge R&D site, many opportunities, but I come from the data science AI track, and similar to what Sophia said, I wanted to kind of maximize the areas I have a look into. So my first rotation was, as I would say, closely related to AI scientist role in the computational chemistry team. and I was involved with using AI for optimizing hit and lead compounds. That's what in the end leads to the API, right? So that's early drug development and very research focused. In my second rotation, which I'm in at the moment, and it's going to end in December, sadly, is in late drug development. And this has to do with clinical documents. So people write these very huge, complex documents and submit them to regulatory authorities or other authorities. And there I build tools for my stakeholders to help them with the reviewing process of these documents. That involves a lot more stakeholder management, a lot more discussions, getting feedback and optimizing these tools, and is much more applied than my first rotation. I also had the great opportunity to be part of this global initiative that I can't disclose the name of, I think, but it was about catalyzing the impact of agentic AI for the whole company. And agentic AI is this very hot topic in the field right now. And that was super exciting. Very quick, entrepreneurial kind of working. So you can see there's a spread of different things and has been very exciting. How about you, Julia?
Yes, I think my roles has been very different. So I started in my first rotation in the oligochemistry team. So my objective was to develop targeting moieties. So the idea was to develop RNA and DNA towards a specific tissue. That was really challenging. It's chemistry. Everybody knows that chemistry is challenging, but it was really exciting. I got to know very new techniques and I explore new areas in chemistry. So that was really exciting. And now I'm part of the second rotation in clinical strategy and development. So something completely different because I wanted to explore a different area. So not necessarily chemistry, but also discover more my pharmacist background. So now I'm working together with the senior clinical directors to support the clinical studies. So my role can vary between medical writer to clinical director. So it's more a supporting role, but I got to know a lot about clinical studies. And so I think it's really exciting to be close to the patients and see an outcome of what we are doing. And my third rotation, I don't know, but it's coming soon. So stay tuned.
I mean, it's really cool that you try different things and, I mean, get a feeling, okay, what do I want to do? So for me, it sounds like a really great perk to have these rotations. I mean, compared to regular entry roles or regular roles. Do you agree, or do you have like any other perks that you would like to shout out?
I would like to begin just of the comparison of the program by itself. I think the mentorship part is a critical part of the program that makes it stand out from the rest of an entry level role. So since my day one, I've been accompanied by a mentor, which is usually a senior leader at the site. And this mentorship and growth you get, it is, I think, extremely valuable.
Yeah, and not only like the mentorship, also like the network, like where you can sit and have lunch with senior leaders and the exchange of knowledge, like we bring in new perspectives, like the new generation and etc. But I think like the rotation itself, like those three are super valuable for us. I mean, like what in what world would you ever get the chance of doing 3 different rotations, 3 different teams, and just be able to explore in that way that we are doing? It's amazing. But I also feel like the biggest pro or the benefit of the program would also be like how we are fostered to take on like bigger tasks and more complex, like the stakeholder management skills. And so I believe that, yeah, those in combinations, I mean, really like put the ground out for the graduates. Like that's where we can see that most graduates like land really good positions after the scheme and everything.
You've all been here a while now. You're in your second or third rotation. Was there a moment when you thought like, okay, I belong here? Did you have that kind of moment, like, okay, the graduate program is, I belong here?
Right in the beginning.
Yeah, the right in the beginning? Love that.
So I think the moment I had this avalanche of invites to meetings, to events, to career talks to buddy meetings. I was feeling like, oh my God, these people are so smart. They all work towards the same goals.
Yeah.
It's just this huge corporation and there's so much behind it. And so many opportunities to work on things you like. So basically my calendar being full of things, me needing to prioritize, do I want to do this or that at that time? It clashes. It was a feeling of, yes, that's the right vibe for me. That's the right dynamic. How about you guys?
Well, for me, I think it was not in the beginning, certainly. It was around like 4 months in, I remember, because I was in the Mexico City site and we had one of the executive vice presidents to come visit the site. So I said, okay, I'm just going to sit in the back and kind of like not disturb the presentations I already have. But no, the site lead came up to me and asked me, oh, we need you to present this part of the work that you're doing. And I said, but I'm only a graduate. What do you mean I'm going to present to this person? like and in English and, and this and that. And he said, well, that's precisely because of it. Because you are a global graduate, we want you to present. So that was the moment I said, okay, I think I fit in here.
Love that. Cool. We invest in our graduates.
Yeah, for sure.
Yes. You have a moment?
Like not a precise or exact moment, but I just feel like, I don't know, it feels like the possibilities are endless. Like you have this, your individual development plan. Like, you could enter a role, but then there's always this dynamic change and stretch of your own development. Like you have a lot of people has been at AZ for over 25 years, like either me. And they have been having super many different roles. They have been in different fields and just, like collecting their own bubbles with knowledge. And that's what I want to have. That's like the opportunity that I want to be in, like a company that, values employees and have this kind of safety net for my own personal development and career development.
For me, it was a very specific moment where I realized, I still remember it was the day where I came in, I looked at the site, I was like, oh my God, I'm working for AstraZeneca. Like it was always my dream since I started my university. I always thought one day I'm gonna work for a pharmaceutical company, but I was not expecting to work for a big pharmaceutical company. And when I told to my friends from university, I'm gonna work for AstraZeneca, they were, wow, that's amazing. So I think it was written somewhere in the stars that I was supposed to come here. Before or later, we don't know. But as soon as I was here, I was like, I'm gonna take the best out of it. And that's when I realized that it was the best time.
Or your answers warms my heart.
Yes,
It's really I love your stories. We have talked about rotations, which is your core business, what you do day to day. But I know that you grads have a big community and network with the other grads and do a lot of activities outside the core business. So I was just wanted to touch a bit of like the community and network, but also what you do besides your core business. And I know, for example, you, Victor, you are the chair of AZ Inspire. So maybe you can explain a bit more about what AZ Inspire is.
Sure. So AZ Inspire is a very large ERG and leisure club. So ERG stands for Employee Resource Group. That means that employees come together voluntarily to organize events for other employees. And we have almost 500 members. And I think it's about 25 people making this happen for all AstraZeneca employees. And we're basically on the mission to make everybody that comes to AstraZeneca feel like they belong.
Yeah.
They connect, build the network. So we do this through our social events. Julia here is the social lead of the committee. These could be events like Halloween parties, like going to the amusement park together after works. There's many different things, go-karting even. And Julia was quicker than me in go-karting. I was very mad about it. So that's the social part of it, connecting. Another part is educating the members, making sure they understand the company better, perhaps especially in the beginning when they come and you have this construct of company before you need to understand it. So educating about the site and helping them develop professionally, personally. And just recently we launched a podcast, actually. So in that podcast, everybody can hopefully bring in their voice and make themselves heard if they want and collaborate. So, yeah, so basically it's a huge amount of events and everybody is welcome to join. And it's just making sure that everybody has a connection. Everybody can build a network, even if you're an expat or not part of a graduate program where we have a lot of connections already right from the beginning. Yeah, so that's
Cool.
a big part of what I do outside of my rotations.
Yeah, so I've been a strong advocate for inclusion and diversity.
Yeah.
So I'm part of the Operations Inclusion and Diversity Council, the Global Operations Council. So I'm the facilitator of that council. We have leaders from Americas, Europe, and Asia Pacific joining in that council. And it's usually site leaders, it's function leaders, just driving the inclusion and diversity agenda. So I agree with that. I think having that extra part on your day that gives you a bit of purpose, and if it's something that you like, it's just cherry on top.
The passion. And I would like to switch focus to you, Petra, and talk a bit more about the programs and the recruitment. I know the audience would love to hear straight from the recruiter of AstraZeneca's Early Talent program. So I would like you to explain a bit more about like the recruitment process and what's the key steps.
Yes, of course. And to start with, the application opens in December every year for Sweden. And yeah, first of all, you apply with your CV and your personal letter. I think it's important to like target your CV to the specific role that you are applying for, and really put in that extra time in tailor your CV and your cover letter. If you are successful and will be shortlisted, then you will have an assessment center. This is virtual, so you can do it from anywhere in the world. This is a full day with different interview steps and also some group activities, and you will have the ability to meet the graduates in the roles today. So it would be interesting to hear from you guys how you felt about the application, then the assessment center day and everything. And also I'm curious, why do you think you are being selected or chosen for this role?
So maybe I can take it first. So for me, already like applying for the graduate program, it was very easy and straightforward. Everything was very well organized. So I knew that I was supposed to upload my CV, to write the cover letter if I wanted to, and then specify the reasons why I wanted to join the graduate program. So that was really like very well specified. So that was not the difficult part. But then when it comes to the assessment center, I can be honest, I was super nervous. I didn't sleep the day before. And I mean, knowing that I was going through it the whole day, it would have been very, very challenging. But then during the day, I can still remember every single moment of the assessment date because it was so amazing. And I mean, all the interviewers were super nice. Everybody was super kind. And I really appreciate that even like in the technical interview, you got the chance to explain and thinking out loud. So it was not that you have to say the right answer immediately. You can think about and showing how you solve the problem, how you see different solutions. And I think that was the best. And it made me feel very comfortable in the situation. So perhaps because I did it, I succeed, I don't know. And I mean, also in the group exercise, it was quite challenging to do it virtually because you don't know the people. We come all from different countries. We have different way how to communicate. And trying to find a solution for a group exercise could be challenging. But if you can show that you can interact and be socially able to interact, then, I mean, you can succeed. And I mean, I don't know exactly why I was chosen, but
Here you are.
here I am. So you can be maybe the one saying why. But yes, I don't know. What about you? Was it different? Did you have a similar assessment day?
For me, it was in person actually. So the assessment day was in person, and I remember being exactly very nervous because it was face to face, back to back meetings, the technical parts, then the presentation. I guess overall, to answer your question, Petra, is just you know yourself and you know your strengths and you know your weaknesses. You can only do so much, right? So the best thing one could do is just be true to themselves and be prepared. It is not a piece of cake, if you will call it. You have to be prepared. You have to read up. You have to just be ready for the assessment day. But I think if you put in the work, it will pay off. So yeah.
I feel like the tips that you're bringing, like be yourself, prepare, but also show your skills. That's really important. I mean, brag. It's not brag. Show your skills. Show what you're good at. It's really important. And if we bring it to you, Peter, as the recruiter, do you have any like tips if someone is thinking about applying to the graduate roles? What should they focus on? What's your tips?
As I said, first of all, tailor your CV. Think about the skills that you want to showcase. It's really important.
Yeah.
I would say that if you look at if you should add that you have been a barista at a coffee shop, for example, you certainly would in that role learn like stress management, and problem solving, and things like that. So in every role that you have had, or if you have been in some sports or whatever, you have learned things. So really try to think of how can I showcase these skills in a good way. That is really important in the CV. This is the first time we look at who you are is via the CV. So that is important. And also the motivation. Why do you want to apply to this program? And why AstraZeneca? And for the assessment center, be very prepared to go through all the materials that we send you in advance and like respect deadlines, be on time, make sure your technical things are working, things like that. But also take that opportunity, prepare yourself, prepare questions. What do I want to learn about AstraZeneca from this day as well? It's a both way situation. You should be able to really learn more about the program and understand what it means.
I think it was a really great tip from you, Peter. I want to shout out that again, like think about your skills that you have gained from different experience. I love that. I really love that. All right, guys, I think it's time to wrap up. We have had some great discussions. And to wrap up, we, of course, need to do a lightning round, which means that I want 3 words each. If someone is thinking, why should I apply for AstraZeneca graduate program? Victor.
We touched about the whole community piece.
And that's 10 words.
Only 3.
Let me go back.
I was kidding.
Community. Challenging. Dynamic.
That's nice.
Petra.
I can't keep it to 3 words. I'm sorry.
Short and sweet.
Yeah, so by joining the program, AstraZeneca will invest in you and your career.
Yes.
And you will have the opportunity to learn, to grow, and to figure out your path.
Love that.
I'm Mexican, so I don't even know if I can do 3 words in one sentence. Okay, I'll try then. Fun, first of all. Growth, I think. And innovation. Yeah.
Yeah. I'm just thinking about like just do it.
Yeah. Love it.
In that sense that I mean, I think sometimes you don't have to think about it so much. Like sometimes, like for example, here now we talked about, everyone listening gets a grasp of what the different programs are about, etc. But then I'm just thinking about, sometimes you stumble across things that wasn't like really planned in life, and then like just apply, put in your effort, as you said, and apply, and then we'll see what happens. Because I think like now it's like I feel just like so like valued for being here and everything, and I think it's super good and nice. So yeah, just do it.
Wow. And for me it would be networking, inspiration, and personal development. So that's double, but
And you all have kind of different words as well. I love it. So it became a lot of words, but I love it. Thank you so much, guys, for joining today's episode and being part of the panel. And thanks to you, everyone who's watching and listening in to this episode of Real Career Talks Graduate Edition.